Hi there, welcome and thanks for tuning in. This video is brought to you in association with Rehab Guru. So a common question I often hear is, should I be prescribing exercises 3 times a day? Well, this is an important question, and often a question that junior therapists will ask with regularity. Now, the answer to the question really depends. It depends on why. Why and what are you after? Now, generally speaking, there's probably really only about 3 conditions really where you would prescribe exercise to a patient 3 times a day. So the first one is if you're interested in preventing muscle atrophy. Okay, then actually prescribing exercises more than once per day, okay, for most days of the week would kind of make sense, because what that's going to do is that's going to improve the intramuscular coordination. Okay, so that's going to help with motor unit recruitment. Okay, and that's going to help essentially to try and maintain, okay, the infrastructure, okay, within that muscle going. It is still going to atrophy. There's no 2 ways about it. Okay, especially if you're immobile, but you're trying to minimize the effects of that. So that would kind of make sense to do that multiple times per day. The other situation is if you're hoping or wanting to improve your patient's flexibility or mobility. Well, again, that requires something which actually has to take place probably multiple times per day. Okay, the other situation is probably, okay, and probably the more common situation is where you're trying to improve the patient's motor learning, motor control, or their skill acquisition. Okay, so you're trying to help them to relearn a skill essentially, or to learn the skill. So these are generally the situations where prescribing exercise 3 times a day would kind of make sense. Anything other than that, if you're interested in muscle hypertrophy or muscle power, or something similar to that, then doing it multiple times per day doesn't really make any sense at all. In fact, actually, you're likely to get a negative adaptation rather than a positive adaptation. So the type of problems, okay, is going to be the patient post-surgically, okay, the patient after an acute injury, okay, in terms of trying to minimize atrophy. That's going to kind of make sense. Okay, in terms of repetitions and sets and so on, it's going to vary. Okay, it's going to vary to varying degrees. Okay, but I think the key thing to take home is the load is going to be moderate. Okay, if we're talking about atrophy. Okay, and also we're going to be talking about multiple sets. Okay, and we're going to be talking about multiple repetitions, probably in the realms of between 10 to 15 repetitions. If we're talking isometrically, then actually we're likely to be holding those isometric holds for between 3 to 7 seconds, give or take. Okay, from a motor control perspective, again, more is better, but little and often, okay, of high quality if you're trying to improve skill acquisition, okay, and motor skill development. Okay, and again, it's the same applies for mobility and flexibility work. Okay, again, depending what you're trying to achieve, but generally, okay, if you're talking about trying to change the tissue, the mechanics of the tissue, okay, whether we can or can't, okay, that's debatable. Okay, but again, they're going to be long stretches, held stretches, static stretches, okay, held for long periods of time. Equally so, if we're talking about trying to effectively reduce the sensitivity of the nervous system, okay, to allow that stretch to take place, so to improve the stretch tolerance, okay, via the nervous system. Again, we're looking at long, slow, held stretches, okay, but this can be done multiple times a day. So hopefully, I hope you found that useful, okay, this short